Dr. Laura Harlock is coming off a 10-day stretch inside the ICU at this Toronto hospital, where 1/3 of its 37 beds with ventilators are occupied by COVID patients.
We're still getting COVID admissions or people with COVID who need our help. It's slowing in terms of the rate a little bit.
The latest hospitalization numbers from Ontario and Quebec are trending downward. But as the provinces reopen, there's concern the dip may not last.
We could face potentially in March a peak which is even higher. That's what we need to avoid.
That's not what anyone wants to hear. With frustrations growing over COVID restrictions and lockdowns as we watch other countries like the UK and Denmark open up.
You can look at what other countries are doing, but please don't just follow blindly what every other country is doing.
Although the majority, almost 78% of Canadians, are fully vaccinated, booster uptake is still less than half. And our healthcare systems continue to struggle. Hospitals and care clinics are extremely short-staffed and workers are exhausted from yet another wave. And in the West, hospitalizations are still rising. Manitoba and BC with record numbers this week.
We can't look at it linearly. We have to look at it all together, what's happening. We have multiple indicators that the peak virus load was earlier in January. We know that hospitalizations follow that.
Health officials also warn Omicron won't likely be the end of COVID. Harlock knows it's almost a certainty more variants will emerge and worries we continue to be reactive versus proactive.
Repeating the same mistakes over and over again is not going to get us anywhere.
I'm wondering how critical care units will fare if they have to weather yet another wave. Jamie Mauracher, Global.